Hi, everyone, and welcome to episode 92 of the ITSM crowd. Today, we're talking about a really important topic. We're going to talk about mental health and considerations for mental health in the workplace as well. So, I'm joined by Petra Velzeboer, who is a real expert in this field. And Petra, if I can ask you first, please, just to introduce yourself, tell us a little bit about your background.
Sure. Thanks for having me, Claire, and thanks to the listeners. So Petra, mental health consultant. So I'm the CEO of a company that does training and development in the workplace and kind of helps businesses think about this topic in a sustainable way. So rather than just once a year talking about it on World Mental Health Day, kind of realizing that it's about humanity and how do we get the most out of our people. My background is psychotherapy, coaching. And of course, like many of us in this space, I've got a personal connection to the story as well. So feeling depressed, suicidal, a whole range of things that then led me to kind of practicing the stuff on myself first. And then I felt inspired to sort of create a career and teach others how to do the same.
Fantastic, thank you. And you can see Petra's website here if you want to go read a little bit more about what she does and pick up some resources. So I'm Claire Agutter. I'm going to be the host for today's session, and hopefully we'll give you some kind of real practical advice to take away from it as well. If you're watching live, you can ask questions using the YouTube comments. So please do feel free to pop those in, and we'll pick them up in the session as well. Okay, so this feels like an obvious question, but why is mental health such an important topic? And in the workplace, why is it an important topic?
Thanks, Claire. Well, it was because people are saying that mental health has become important because of COVID,
Mm-hmm.
because of the pandemic and everything that's going on. But being in the space for over 10 years, I know that this topic was bubbling underneath the surface, and we were talking about the mental health crisis long before COVID actually hit, and just made it a bit more visible for people to see. Now, the World Health Organization said that depression has been the leading cause of disability worldwide. So this is, again, pre-pandemic. And there's reports now just around the rise of anxiety and depression. And of course, other things that if people have a predisposition for a mental illness, the state of the world is really impacting us. So isolation, working from home, but also not having natural boundaries of work and life. So we've got to create them. Perhaps you're a parent and you've got kids at home, all the range of things that we've been through. But what's happening in our body is we're essentially in that fight or flight state all the time. Now, we're supposed to be in that state if we're in danger, right? Quickly,
Mm-hmm.
for a little short bit of time. But when our body is in that state for months and months, which it's turned out to be, well, actually, our nervous system gets a bit shot, right? And so we actually have to be more conscious about movement, meditation, all the things that help us, because we're sat in one place, which isn't natural for many of us. We're not moving around. We're not socializing in the same way. So no wonder our mental health has been affected. But I would say that we all have mental health just like we have physical health. It's
Mm-hmm.
simply the health of our mind. So in the same way as we might go to the gym or move and we think about the health of our body, like mental health is aspirational. If I'm successful and good at what I do, I've invested in my mental health to get me there. Right? So it's kind of a re-education about what it is. And certainly we spend most of our time at work, right? If you think about the amount of hours that we're at work, we can't just park our mental health as we show up, right?
Mm-hmm.
It's part of our whole selves that we're bringing to work. So that's why it's just really important to focus on at the moment.
And I think we've seen, mental health has always been important, like you say, but recently we've seen more of a public discussion about it. And I'm thinking about things like Simone Biles at the Olympics, the people who are very public figures now being willing to talk about mental health. And is that a positive thing that you see?
I think it's massively positive. Part of it is the younger generation have been, anxiety is higher for them, but also they've been raised to be a little bit more open. So culturally, they can talk about some of this stuff easier than perhaps the older generation where it wasn't the done thing back in the day. So yes, those are positive things. But of course, social media and all of this openness also has both its good bits and its negative bits, right? So where we see online bullying, where we see, people
Hmm.
shaming each other for, when we saw the football and how people were attacking the players who lost, we're certainly seeing both sides in this world. But the more open we can be, the better, for sure.
And just thinking about social media and technology, and coming back to perhaps the changes that many people have had in their lives in the last 18 months, what is the impact of technology? So, for example, for people who are perhaps office based and are now working from home and spending a lot of time on Zoom and Microsoft Teams, how does technology and that change of interaction affect people's mental health?
I think it's affecting us in a bigger way than we know. Right from, like I said, just being sedentary, our eyesight, our physical health, our posture, just things like that, as well as, that lack of connection. So loneliness or isolation are one of the key sort of risk factors when it comes to poor mental health. And so,
Hmm.
yes, we're looking at each other, Claire, but are we really connected? If we don't truly check, we checked in a little bit before went live, didn't we?
We
So
did.
people are definitely feeling the difference. And I would say, even before this, social media, technology, again, it's how you use it that creates
Hmm.
the biggest sort of impact. So if you're addictive scrolling and you're just comparing yourself to others and all of that, that's going to affect you. Like these days, I ask people to do audio calls so I can walk. So I'm not on
Hmm.
video the whole time because I could feel it in my body, right?
Yeah.
So we've got to be a bit more proactive in how we consciously think about using it.
Yeah, absolutely agree. And is it possible to have this meaningful connection through technology, or do you believe that human to human interaction is best?
So, so both. Yes, I believe that human to human connection is best. And we found loads of creative ways to genuinely connect with each other. So my whole team are remote. We only actually
Hmm.
met each other in person about 2 months ago. And so we've
Wow.
onboarded people, we've hired people, a whole host of things have happened completely online. And we find that we've got to be more explicit online about how we check in and the space we create for connection. So that could
Hmm.
be at the beginning of a team meeting, asking people, what's one thing you're proud of? Or what's the biggest challenge you're facing? Or how are we feeling emotionally today? We kind of push the boundaries. We're a mental health organization. But in our leadership training for others, we sort of give them tools and ideas to protect bits of time so that it doesn't just become task focused. So Teams
Hmm.
fatigue, Zoom fatigue, you're just talking about tasks, and you're not creating space. You're like, oh, this isn't important enough to talk about. It feels more formal in an online setting. So giving people permission and small sentences to help them
Yeah.
connect. I mean, we've had team meetings where we've cried and people have like really opened up about really deep things. So I think everyone would say we're as connected as we could be in person, but that doesn't take the place of a hand on the shoulder,
Hmm.
noticing those small things, a shaking of hands, hugs. Those are the things that we feel are missing.
Yeah, and I must admit, because my team is virtual, and we've always been virtual. And prior to this, nobody ever put a camera on. So we always had our team meetings, and it was just blank because everybody just spoke, and we didn't put a camera on. We didn't feel the need to, because we'd see each other once or twice a year. And since COVID, the first team meeting that we had was just talking about how we were feeling. We didn't talk about anything work related in that meeting. And then since then, the cameras have come on, and we feel, I think, that little bit more connected, just because the technology is there. And in a way, thank goodness for technology.
Completely.
It's been a huge benefit as well. So you mentioned there's some kind of techniques in terms of helping the team to connect, but for the people who are watching this, who are working from home, juggling children, other family members, keeping the home running, work. Quite a lot of our viewers, I know, are working internationally as well. So they've got calls happening outside of normal working hours. What other techniques can you recommend to people to help them just protect themselves a bit and become a bit more resilient?
Great question. I'm a parent of two teenagers, so I certainly know the juggling act that takes place when you're trying to. I'm working in my living room. I'm doing these sorts of
Yep.
things in my living room. I don't have a private office, so we've had to do different setups so that everyone feels comfortable. Everyone is different, and so what I would recommend is creating a little bit of space to consciously kind of zoom out of your
Mm-hmm.
routine and your life and just see where are the places that you're just in habit mode. You're just doing it because, right? You haven't even questioned your manager, your boss, your team about what is required versus what is, just being pushed my way, but I could push back on it in some way. So
Mm-hmm.
finding out what is allowed within, like what is in your control within your routine and your schedule. And then seeing what are the boundaries that are going to help you be your best self. Now, boundaries feels like a big word, but it could be a little thing like when I finish work at 6 or whatever time it is, I shut my laptop down and I go for a walk to shake off my work day and return into my home ready to
Mm-hmm.
focus on family or whatever it might be. It could be I'm going to take that break so I can move in the middle of the day. It could
Yep.
even be with your kids, just saying, hey, this is what I'm going to do to look after my well-being. What about you? So that there's a powerful message in leading by example. When we do
Mm-hmm.
these things and we talk about it, there's a positive ripple effect on others. So zoom out, think about what's there for you, create some accountability buddies. So that could be
Mm-hmm.
somebody in your team. So we do that. We're like, how are you going to look after yourself today? Oh, I'm going to go for a swim. I'm going to meditate, whatever those small things can be. And then on
Mm-hmm.
Slack, we'll be like, hey, have you done your thing? Have you done your thing? So that there's this sort of positive accountability. And that just helps you feel connected as a team. But also when you slip back, because you will, because life's
Yep.
difficult at the moment, it's fine. You've got that community of people going, all right, yeah, I messed up yesterday. Let's try again today. So it's personal to you, but don't forget that you need a bit of space to decide what's beneficial for you now.
Yes. And I mean, we have people watching this who are managing teams as well, and quite often those teams are now sort of virtual and disparate. And one of the things I've seen, particularly in the mental health space, I think is I guess I'd call it a fairly superficial recognition of mental health. So, for example, a friend of mine who works for a large organisation, they've all been told to take an hour in the middle of every day and do what you've just suggested, go for a walk, go for a swim. But that hour has very quickly become, this is my free time to catch up on work in between meetings. And the gesture's been there, but it hasn't been reinforced, I think, particularly by the leadership of the organisation. So are you seeing more commitment from leaders and managers within organisations? Do you think businesses are starting to take this seriously?
Yes, they are. There is still a sort of big divide between people who are genuinely putting in the effort, the budget, the work, and those who are still at the early stages. They see that
Mm-hmm.
it's important, but they don't quite know how to do it. But you hit on a really good point, is that when, first of all, with that company, I'm wondering, did they talk to their people about what they wanted and what was going to benefit them? Or was it like, hey, we think everyone should take a break at this time because it's easier for us to know
Yep.
exactly what people are doing, top down. So I would
Mm-hmm.
try and consult as much as possible, go, hey, we're coming into hybrid working now, like it's changing again. How can we experiment as a team together? And if something's not working, adjust. Like that's what evolution is. It's going, hey, this is now a new variable. How do we adjust ourselves now? So it's worth talking to your people, checking in and changing it if necessary. But also, are the leaders doing what they're asking people to do? That is, again, the
Yes.
most powerful message that you're taking this seriously, is if a leader says, hey, I can't do that international call because I'm at the gym at 8 a.m. or whatever it might be. And then you're like,
Mm-hmm.
oh, they're not just saying, oh, go do this thing, we've got to tick the box, but they're
Yep.
actually living it themselves. That's the most powerful way to create change.
Because I was reading something yesterday, and I always feel like there's this conflict between technology and the human elements of the workplace. And I was reading something yesterday about there was Apple, Uber, and for their contact center people who were working from home, they were requiring them to sign a release form to approve the fact that they were going to be on camera all day so that their employer could watch them in their
Oh, good
home
God.
working. And you just think, how, who made that decision? What were they thinking? And we as managers, how are we balancing this kind of ensuring people are productive without these really horrific, we're tracking your keystrokes, we're monitoring your toilet breaks.
Yes, we
It
see
seems
everything.
astonishing to me. Yeah. Yeah.
Well, what
It,
what we would say is what you need is a psychological safety is the phrase. So a
yes.
space where people feel comfortable being open, but crucially they feel trusted. Now, when you feel
Hmm.
trusted and you have autonomy over your job, that's one of the key factors that improves your mental health at work. When you're micromanaged, when you're not trusted, when it's fear-based, well, am I going to be honest with you about stuff? No, I'm worried that every little thing is like, you don't trust me, right?
Hmm.
So that's like in any of our training that we do, it's like, how do you create psychological safety as a leader so that you do get loyalty, trust, productivity, all of these things, but through a different route than sort of
Hmm.
holding tighter. It's actually a letting
Yes.
go and a trusting that people need to be judged more on outcomes rather than
Hmm.
process, right? And that's a
Yes.
really new way of thinking about work because it's always been like 9 to 5. Are you doing exactly this much? And people like by 3 o'clock, if they're good, productive people, they'll be like, I'm done, but I'm not going to say anything because, this is the
Yeah.
structure that we work in, right? They're just going
Yeah.
to give me more work. So we actually need to think more about outcomes. Are people reaching those outcomes? How they get there and how they look after themselves in the middle shouldn't be as big a deal if they're achieving the end game.
Yeah, absolutely. And I think as a team member, when you're in a fairly toxic environment, it can be quite difficult to see that. You feel bad, you know that the team isn't healthy, but you kind of get lost in it at that level. So I think if looking at it from an organizational perspective, what shows you that this is a healthy workplace and a safe workplace? What kind of signs would you be looking for?
Sure. So there's the main ones which are more the data driven. So is
Hmm.
there long term absence? Like are people taking stress leave, sick leave? Like is there high staff turnover? So people
Hmm.
don't stay that long because of how that feels and it's too toxic or their anxiety goes through the roof. What are your numbers if you have an employee assistance program or benefits? Where people access occupational health support, whatever. So, what are some of those numbers? What's the motivation like? Are people driving
Mm.
together? Does it feel like a team going somewhere? Are they productive? Like all of these things are pieces of the puzzle. And then I would always ask questions about leadership. And I would ask questions about departments because sometimes a department feels safe, but other ones don't.
Hmm.
And just culture. Do people feel comfortable being open and talking? But sometimes you have to go beneath the surface because I'll have a first conversation and they'll be like, yeah, we're really close and everybody's, and I'm like, all right, let's ask you a few more questions. And you scratch beneath the surface, or we run a workshop and people are like, I had no idea other people were struggling. I had no idea. And you're like, well, that's not that psychologically safe then, because it's all like banter and like, hey, how was your weekend? And that kind of vibe rather than what's really going on for you. So I always want to
Yeah.
scratch beneath the surface of mental health champions or these things that look shiny on the outside, but if there
Yeah.
isn't human connection and bravery, well, then you're missing something. So that
Yeah.
those are the signs that it's less healthy, and that gives us a roadmap then to support them to become more mentally healthy.
Yeah. And I think one of the things that puzzles me, those things you were talking about, sickness, staff turnover, unmotivated employees. Even if you are one of these people who thinks mental health is a little bit woo and a little bit fluffy, because I still come across that
Yeah,
from a management perspective, these are very quantifiable financial things. There is a cost to the organization every time somebody leaves, every time you have to recruit a new staff member. So it does surprise me sometimes when people see this as the nice to have, the little cherry on top that we'll do when we've done everything else in the business. Is it still an attitude you come across?
of course. That's definitely an attitude. And now that we're more globalized, we're seeing, the difference between the U.S. sort of marketplace, the Middle East, Europe. They're a little bit behind, I would say, the UK and Australia when it comes
Mm-hmm.
to sort of embedding this conversation. But yes, you bring up a financial argument. So if you want to talk about the business case, like, hey, we got to focus on this, just go to Business in the Community, BITC. They've got a report every year about the numbers, what it's
Mm-hmm.
costing you when you don't do this. The World Health Organization are releasing some guidelines about workplace mental health. Like, this isn't going away, and there are key numbers and finances to back it up. So not
Mm.
focusing on this means you end up getting costs, like you said, through staff turnover, but also suicides and like the
Mm-hmm.
crisis end can happen, which is not what anybody wants to hear, but it does happen. And so we're always coming from that prevention perspective. Let's start 10, 20 steps before,
Yeah.
but many interventions are very crisis driven. And that's not
Mm-hmm.
always helping the stigma, because it's just going, mental health is crisis. It isn't. It's about all of us and how we show up, right?
Yeah.
So that's where we would come from.
Yeah. And I think culture is always a fascinating element when you're in the global the global workplace. I always think there's kind of a European out of office, which will be, I'll email someone in Denmark, I'll get an out of office that says I'm away for a month, and I'll hear
Yeah.
nothing from them for a month. And then I'll email someone in the UK and I'll get a reply saying I'm out of the office, and it just means to ring me back in 2 hours rather than 1 hour. It's fascinating to see how that comes across in different countries and different cultures. And I think there's things that we can all learn from each other about what we do well and not so well. So there was one last topic that I wanted to touch on, because we've talked about the COVID crisis and people working from home and having to make that fit around everything else. But of course, this is leading to longer term changes, which will in effect become business as usual. And that there is the normal kind of commentator disagreement. You've got people saying everybody has to go back to the office. You've got some people saying no one will ever go back to the office, and the hybrid state in the middle, which I suspect is where many organizations will find themselves. But in terms of people who've had this crisis period at home and now starting to return to something vaguely resembling normality, what kind of strategies can employers take to support people as they come back into the office?
So first of all, everyone's different. We sometimes think everyone's experiencing it the same, like either
Mhm.
everybody's stressed and anxious or everybody's excited and can't wait. And there's a continuum. So like every people are actually just dotted around the middle of, like, some people are really anxious still about health, perhaps they're sort of got
Mhm.
vulnerable parents or whatever. And some people are genuinely like, I am over this and I just need to go back to an office, right? We've also had that when people are back in the office, like, yay, it's back to normal. They're like, oh, there's nobody here, or we're not allowed to share the coffee area because we can't have the same milk, or we can't, my friends aren't in, or, there's a whole host of sort of disappointments where my meetings are still on Teams on my headphones, even though I'm sat in the office, right? It's not like
Yes.
we're back in the boardroom. So leaders have to know that everybody's different. Have some open conversations. We've got to
Mhm.
renegotiate in a way how we gather and how we do meetings and what works and what doesn't work. Even to the point of, is this meeting still useful? do we still need to be doing this? Because like, it's just like meetings back to back, and you're thinking, how can we use this as an opportunity to renegotiate how we do things? And there's a great podcast I would recommend, Brené Brown's podcast, Dare to Lead. She interviews someone called Priya Parker. And it's all about this point: gathering, renegotiating. What do we think about as we re-enter whatever the world looks like? And also, I think there are some people who will want to stay from home and renegotiate how their contract looks. And we've got to be open to those conversations as well. Whereas some old school people are like, I had one guy say, I need to eyeball my people. And I was thinking, oh my goodness, oh my. But I would treat this as an opportunity rather than a problem to be solved, right? And then that brings people along with you. Hey, how can we figure this out together? What do we need? Rather than, I'm going to tell you to do this thing. And it's basics, isn't it, Claire? Listen, just navigate it together. You don't have to know all the answers, and you can be vulnerable as a leader and admit that. And that actually will help you go on the journey together.
Yeah, absolutely. And what kind of trends have you seen as a result of this with the conversations that you have? Do you see more people wanting to work from home? Do you see people wanting to go back to the office? Is there anything that you see that's becoming the majority?
I think it's still a super mixed bag. And I think in some countries like the US, I'm seeing it being more required to come in for certain industries. And so I think that extreme probably is less useful as an approach. I'm not seeing a trend. I feel like there's a real range of people who are really anxious and people who are really excited, and everything in between. And that's fine. We're humans and we all have a range, right? And I would say for the individual, so you're the employee who's maybe anxious or nervous, right? First of all, that's okay. Second of all, be proactive about your own mental health. There's so much learning out there on YouTube, on LinkedIn Learning, on podcasts, to just get yourself in the zone of positivity, of what is possible, mindset tools, because sometimes we can get stuck feeling like a victim. Like, oh, I just feel like this, and this is never going to go away, and get defined by our label of depression or anxiety. And so I just want to free people up to take personal responsibility, even if that means talking to your boss and saying, hey, this is what's going on for me. I know I will be more productive in this environment. What can we do to make that happen? It's a proactive conversation rather than just going, oh, they want me to do this. And, it's like each of us can take responsibility for communicating what we need, but it takes slowing down enough to even know what that is, right? Like, hey, because it might be different from one day to the next. Today I need to meditate and work out. Tomorrow I need to sleep, go to sleep early. The next day I actually need to connect and socialize, right? So it's like we're doing a bit of this, right? As things change. What do you think, Claire, if I can ask you a question? What do you think you need the most and your team needs the most to navigate this time?
Gosh, it's a good question, because there have been a lot of things that haven't changed for my team. I've been a home worker for more than 10 years. I'm very lucky that I'm set up for that. Our team is virtual. The biggest change has been more time spent in personal conversations, and actually deliberately making space for personal conversations. And as kind of a business owner and a leader, that's been quite challenging sometimes, when maybe I've not felt strong enough to do that. But looking after the team is something that needs to be balanced as well. So I'm conscious that we're coming to the end of our time. We love to finish on a top tip. So if there's one thing that you could say to people who are watching this, whether live or on catch up, what would be the one thing that you would tell people to go do at the end of this episode?
Move your body. If there was one tip, and there's science behind movement preventing burnout, which is one of the key things we're seeing at the moment. So moving every day is actually what we call completing your stress cycle. So that could be dancing in your kitchen with your favorite song. It could be walking around the block, or going to an actual class, walking with a friend. But we have to consciously move. That would be my big tip.
I would absolutely endorse that, and even more so when you don't feel like doing it. That's always the
Do
battle
it
for
anyway.
me. So just a reminder, you can learn more about the work that Petra does on her website. She's mentioned a few of the tips throughout the episode as well. From me, I would like to say a huge thank you to you for taking the time. That's been really, really interesting discussion, and the time's absolutely flown. We are still scheduling our September episode, so keep an eye out on our social media. We'll announce that as soon as it's locked into the diary. But for today, thank you so much for being with us, Petra. Thank you, everybody who's been watching, and we will see you on the next episode of the ITSM Crowd. Thank you.
Thanks so much.